Welcome to Newborn. My name is Amber.
And I'm Rebecca.
The goal of this video is to review the new AAP 2022 phototherapy guidelines for hyperbilirubinemia. Just a little bit of context for this video. All newborns are screened for hyperbilirubinemia at time of birth to help decrease the incidence of kernicterus that we see in our country. So before we begin, just some key vocabulary terms before we start. The first one is TCB, so that's our total transcutaneous bilirubin. So this one is taken with a light applied to the forehead. It's therefore less accurate than our serum or blood level bilirubin. That's our TSB, our total serum bilirubin. So this one's more accurate, and this is actually the level that is required before we start phototherapy. You'll hear us say multiple times this video that you'll never start phototherapy based upon a TCB. We always want a TSB. We want a blood level. And then once a baby is started on phototherapy, we only ever use the serum bilirubin because the transcutaneous bilirubin is no longer considered accurate at that time. The last word is threshold. And when we say threshold, we're referring to the phototherapy threshold as determined by BiliTool, which is our online tool that we use to help determine when babies should be started on phototherapy.
And we will go more over this online tool as we progress through the video.
So this is our overall pathway for phototherapy screening and treatment here at the hospital. This first page, this first guideline discusses the screening and management of newborns admitted to the mother-baby unit on the floor.
And as we progress through the video, we will go piece by piece to break down the guidelines so it's not so overwhelming.
And this is the overall flowchart guideline for initiating phototherapy on the newborn unit floor. So the first question should we get cord blood on the baby? So there are 3 criteria that determine whether or not a baby needs to have their cord blood collected at time of birth. So one of 3 is Rh negative, if the mother is Rh negative, if the mom is O positive, or if the mom is positive on our antibody screen. So typically this cord blood will be collected at time of birth from the umbilical cord by the OB-GYN resident. But every so often, a baby that needs to have their cord blood collected has not. And so if that's the case, just go ahead and order a stat type-in screen.
And you can find the results of this in Results Review in Cerner. So next we're going to talk about if the baby is Coombs positive, what do we do? So if they're not Coombs positive, you just collect the TCB at 24 hours of life and then daily, and then the day of discharge. On the day of discharge, it is typically collected at 5 a.m., and that's just to facilitate discharge planning. If the baby is Coombs positive, so that's if we see Coombs positive on the results review page again, you need to order a TCB now and then every 6 hours for the first 24 hours of life. You'll do every 6 to 12 hours if these levels that you're getting are close to phototherapy, just to assure that we're not reaching that level. And then after that first 24 hours of life, you can continue to check every 24 hours if you're not close to the threshold.
And most importantly, and if a baby is Coombs positive, that means they're hemolyzing. And so if you remember, hemolysis in the blood increases your levels of bilirubin. And the number one way that babies secrete, or all of us secrete our bilirubin, is through our urine and our stool. So it's really important that we encourage feeding on the mom's part. We want a deep latch. We want increased frequency of breastfeeding or formula feeding. And our goal is at least 9 feeds in 24 hours. Typically, we recommend feeding every 2 hours at this time. And if required, we can go ahead and start formula supplementation depending upon mom's milks and colostrum supply.
And what is phototherapy threshold and how to get close to it, you might ask? We will talk about that shortly as we talk about the BiliTool website. So next we're going to talk about what happens if they are within 3 of this threshold.
So we ordered our TCB at 24 hours of life, for example, and we type it into BiliTool, which will show on the next slide. If it's within 3 milligrams per deciliter of the phototherapy threshold, we'll go ahead and order a stat TSB, ensure adequate feeding, and then based upon that TSB, we'll proceed either with phototherapy or not.
And again, this box tells us to assure adequate feeding. This will be a very common theme throughout this pathway because, as Amber said, it's the only way we can get the billies out of the babies.
So this is bilitool.org. So what you're first going to do, either you can fill in the date of birth and the time for the baby and the time at which you got your sample, or you can just type in the age of life.
And you can find the date of birth under the labor and delivery column inserter.
Then you type in your bilirubin level and then your gestational age. And then we go on to neurotoxicity risk factors.
So, what are the neurotoxicity risk factors? In our institution, we really only look at if they're Coombs positive or negative. Technically, if they are under 38 weeks of age, that is also a risk factor. However, BiliTool already incorporates that into its algorithm. So if a baby is Coombs negative and born at 37 and 5 days, you would still click no.
If a baby is Coombs positive, you'll click yes. Typically on the newborn floor, the only positive neurotoxicity risk factor that they would have is if they're Coombs positive.
So this is what the website looks after you hit submit and put everything in. So in this example, the baby was 29 hours, the bilirubin level was 8, gestational age was 37, and they did not have any neurotoxic risk factors.
So our threshold for repeating our TSB, you can see is 9.6. Our threshold for phototherapy would be 12.5. So at this time, because they're not meeting the threshold needed to repeat the TSB, we would go ahead and continue with TCBs moving forward.
Yeah, and the distance between this is greater than 3, and that's why we are not in that range. Once it approaches 3, that's when you would have to check your TSB.
And this is a graph interpretation of the same data we just talked about, depending on if you're a number versus a graph type of intern. So basically you can see here, the green dot is our patient. That is their TCB result level. The blue line is their phototherapy threshold. So if they're above that blue line, they would need to be started on phototherapy if it was based on a TSB, of course. The yellow line is our escalation of care, aka NICU. And our red line is our exchange transfusion criteria. We'll go over the criteria for transferring to NICU in a later slide when we talk about the red and yellow lines.
So next we're going to talk about what happens if we confirmed the TSB is at above phototherapy threshold. So if you order your stat TSB based on your TCB being within 3 of phototherapy threshold, as again, you want to ensure adequate feeding, go to the mom while you order the stat TSB, and then go to the room and talk to mom about that we're going to collect the blood level and to ensure she is feeding adequately. And then if that value does confirm that you're at or above phototherapy threshold, again, based on your TSB, not TCB, blood needed, then you will have to start phototherapy threshold, and we can talk about this more as we go through our phototherapy algorithm. So again, this is just the entire pathway to have an overview.
For your Cerner order set, you're going to go under Neo-Ped Hyperbilirubinemia. There you're going to select phototherapy. While they're on the newborn floor, we only have the Bili blanket available. We don't have the actual chambers available. So under that drop-down menu where the arrow is located on the right side of your screen, you choose blanket. And then of course, you need sunglasses when you're sunbathing, so make sure we always apply a Bili mask to the baby's eyes.
So this is the beginning of the phototherapy algorithm. So we're going to talk about what to do when we are on phototherapy. So these are things you're going to want to tell mom when you go in.
So most importantly, we want mom and nursing to maximize the surface area. So the phototherapy blanket is more effective when we can get more surface area to help dissolve that bilirubin. So we like to go ahead and call it the bikini diaper, as Dr. Baez likes to say. So we can tuck the diaper in nice and trim so they can get maximum surface area.
But enough to still cover any poops or pees.
Yes. We want to empower mom to continue feeding as much as possible and also to readjust the blanket as needed. Mom should feel free to be able to pick up the baby with the Bili blanket on. And then again, concerning feeding, we want at least 9 feeds in 24 hours, typically about every 2 hours during the day and every 3 hours at night. But number one rule is when baby is hungry, baby gets fed.
At our institution, we are what's called a baby-friendly hospital, so we really encourage breastfeeding in all our moms. However, we also need to let our mothers know that sometimes it takes a little longer, especially if it's their first baby, to come in. So during this time, if they want to start formula feeding to ensure he's getting adequate feeding, ensure that they're pumping so that they don't lose their supply. And this is an adorable baby in sunglasses to remind you to order sunglasses while your babies are on phototherapy.
So now we'll go into the section of whether or not we're concerned for hemolysis. So the things that make us concerned for hemolysis, other than being Coombs positive, is if baby met the phototherapy threshold within the first 24 hours of life. If we see a rapid rate of rise, meaning more than 0.3 rate of rise in the first 24 hours of life, or more than 0.2 thereafter. And then we would also be concerned for hemolysis if this TSB continues to rise despite being on phototherapy and getting adequate feeding.
And you can calculate the rate of rise by calculating your most recent two TSBs and then subtracting those from each other divided by the length of time separating the two. So it's a ratio.
So first, if there's no concern for hemolysis, we would go ahead and get the TSB 12 hours after we started phototherapy. And then after that, we would continue to check it every 12 to 24 hours until discontinued. Speak with your attending. Some prefer every 12 or every 24 hours. That's just a conversation you guys will have. Now, if there's high concern for hemolysis, we will check it 6 hours after phototherapy initiation. And of course, always reevaluate for signs of adequate feeding. If the TSB is rising, we will continue to repeat the TSB every 6 hours until it's stable or begins to trend downward. But if the TSB is not rising, we can go ahead and space out our checks to every 12 or 24 hours. And remember, because we're on phototherapy, we're only checking the serum level and not the transcutaneous level. Now, when do we transfer to NICU-D?
So criteria for NICU-D transfer is if our babies are Rh negative, so Rheus isoimmunization requiring phototherapy. Most of the babies in our unit that end up being Coombs positive happen because they have ABO incompatibility. So that was when mom was when mom was O positive, and then babies are either AB or AB. If they are Rh negative, requiring phototherapy, they are at higher risk for hemolysis, so that's why we'd want to transfer to NICU-D. If they have any kind of neurological dysfunction, so that means if they're poor feeding, or if they're tired than usual, more lethargic, that's how babies demonstrate neurological dysfunction. Or as we mentioned in the previous slide, if the rate of rise of the TSB is greater than or equal to 0.2 mg per deciliter per hour since phototherapy initiation, or if the TSB is within 2 milligrams of exchange transfusion. So thinking back to when we were on the Billy Tool slide, that's what that red line is. It's also in the chart, whichever way it makes more sense in your brain.
And most importantly, we're so excited to have you all as new interns. If you ever need anything overnight, I know newborn can be very scary overnight, but we have a NICU fellow that is always available. We have the nurse practitioners in the NICU-D area that are also available, and we have the second years that are doing night cross covers upstairs in the PD library. So everyone's available to answer questions and to help you move through this pathway if you guys need help.
Don't forget to ask for help if you need it. We are nice, we promise.
So now we're going to discuss criteria for discontinuing phototherapy. So we will continue phototherapy until our total serum bilirubin has decreased to 2 below the phototherapy threshold at time of initiation. So we're going to look back to that original threshold that we looked at when we started the phototherapy. Once we discontinue phototherapy, we want to assess the need for rebound hyperbilirubinemia. So they're at high risk of rebound hyperbilirubinemia if their phototherapy was started within the first 48 hours of life, if their gestational age is less than 38, or if they were Coombs positive, or like we mentioned, if there was concern for hemolysis. If there's lower risk for rebound hyperbilirubinemia, you would just go ahead and follow up with their outpatient PCP the next day to do a repeat screening for their hyperbilirubinemia. If they're higher risk for rebound, we would want to keep them and double check their TSB at 6 to 12 hours of life after we discontinue the phototherapy. And of course, if their TSB is above the current phototherapy threshold, we would restart phototherapy. Something to mention is that when we're discontinuing or considering to discontinue phototherapy, sometimes we're not always quite below the 2 below the threshold at time of initiation, especially if they had phototherapy initiated earlier in life. But that's one of those discussions to have with attendings if they feel comfortable discontinuing it earlier at an earlier time. So we'll make a next video to discuss future cases. But this is another sunbathing baby. Thank you all, and we'll see you in the next video.